here's another question that one of my tootRN students sent my way. So she was actually doing some NCLEX practice on her own, and she came across this question, got it wrong, and just needed some help on it. So we went over it, but I wanted to share it with you because I thought it was a good question to kind of share with everybody else. So this question, I believe, came from Saunders. I think that was the resource that she was using. So this question asks, while changing the tapes on a tracheostomy tube, the client coughs and the tube is dislodged. Which is the initial nursing action? Call the healthcare provider to reinsert the tube, grasp the retention sutures to spread the opening, call the respiratory therapist to reinsert the tracheotomy, or cover the tracheostomy site with a sterile dressing to prevent infection. All right, so first thing, we're always using our tootRN 3 steps and our critical thinking tools that we have. First things first is identify what the ask is. So this question quite simply is asking us, well, what do you do now, right? What's your initial nursing action, which means right now. Now, step 2 says, well, what's the problem? We find the problem by looking at the data the question's giving us. That way we can start to apply our knowledge and think about that. So what do we got? We were changing the tapes on this the tracheostomy tube, and the client coughs and the tube is dislodged. So we've lost our airway. Right? That's what we're thinking. We're thinking if the tube is dislodged, well, we need that in place. We need that in place because this is this client's airway. So we're concerned that we need to get that back in place, or we need to maintain that airway open, make sure that that trach site is patent so that this patient can still move air. That's our priority. So when we think about outcomes and trying to find our solution, which is in step 3, we're looking for that in our answer options. Which one is going to help us to accomplish that outcome? So A says, call the healthcare provider to reinsert the tube. Okay, great. We can get that tube in place. But what are you doing now for the client, right? It did say initial nursing action. So A, great, get someone to come and put the tube back in, but you're not doing anything now for this patient and the airway that right now is in compromise. So B says, grasp the retention sutures to spread the opening. So that's actually really helpful. That's something that we can do right now to make sure that we are keeping that site open and we don't lose that site, which in turn would mean we're going to lose the airway. C says, call the respiratory therapist to reinsert the trach. So again, really similar to A, and if you know anything about tootRN, you know that these are copycats and we like to get rid of those. So calling the respiratory therapist, you're calling somebody else to come and put the tube in. Okay, great. But what are you doing now for the patient? The question's asking for the initial action. You have to do something now for this patient to make sure we don't lose this airway. And D says, cover the tracheostomy site with a sterile dressing to prevent infection. So great for you for thinking about infection. However, thinking about outcomes, if you cover that site with a sterile dressing, then you're going to lose that airway, right? You're occluding the airway. That's not a good idea because the whole purpose is that we got to keep that open until we can get that tube in. Whether we put that tube in ourselves or whether somebody else does, we have to make sure that we maintain that airway open so that we don't lose it. And that would bring us to answer B.